Hi, good afternoon everyone, and welcome to this Tutor to You BTEC National revision live stream. Tonight we are revising Unit 2, Working in Health and Social Care. I'm Liz and this is Lynn with me. Hi Lynn.
Hi everyone, welcome.
So tonight we're going to be looking at monitoring the work of professionals and inspection and regulation of services. Just a reminder, this is your last but one live stream, so we've got one more on Sunday at 5 p.m. and then your exam is next Monday. As Fida says in the chat, good luck to everyone with the exam. So Lynn, shall we get going?
Let's get started, yes.
Okay, so our first activity this evening is a Give Me Three. I would like you to give me 3 professional bodies that regulate the work of health and social care professionals. I'm sure you know what to do. Please type your answers in the chat. I'm going to give you a 30-second musical timer. Let's go.
So let's have a think. Professional bodies. Even if you just know one, if you could put that in the chat, that would be great.
You can see we've got some people typing away already.
Okay, and we're focused on the health and social care professionals. Okay, for this one. We've got some people that have done their revision, Liz.
Okay, so we've got Phoebe, Charlotte, Amelia, Paige. Let me just scroll through. Zainab, hi Zainab.
Yep.
Melvin.
Hi, Zainab.
Fida, Sephora. Okay, so those of you that have written HCPC, NMC and GMC, excellent, well done. I believe you are correct. Do you agree, Lynn?
Yeah, absolutely, because they're professional bodies and they're regulating professionals. So you get a round of applause. Excellent. Yeah, really good.
So just to confirm, General Medical Council. If you know who they regulate, please type in the chat, put GMC and then tell me which professionals. Nursing and Midwifery Council, the NMC, that's quite obvious, isn't it? That's nurses and midwives. And then your final one, Health and Care Professions Council, HCPC. If you know which professionals the HCPC regulate, just give me a little type in the chat. Just one example will do. Phoebe saying doctors for GMC, brilliant, thank you very much. And yep, Charlotte and Zainab also saying GMC, doctors, FIDA as well. Anyone
Excellent.
Want to tell us about HCPC? Yep, Phoebe, brilliant, allied health professionals, and gave me an example, paramedics. Zainab said occupational therapists, and Charlotte did as well. Amazing,
Well
definitely
done.
Lots of revision going on.
Yeah, brilliant. And really active on the chat tonight, so that's fabulous. Shall we have a little look at this one? So this is the lineup. So we're going to give you 4 sentences, and I want you to say which of the following is being described. Okay, so is it duty of candour, code of practice, complaints procedures, or national occupational standards? And I'd like you to write in the chat either A, B, C, or D when you think you know the answer. So Liz, can we have our first clue, please?
We can, yes.
Let's have a look. So it applies to all employers and workers in the health and social care sector. Okay.
I think
applies
that could
to
be
all employers.
any of them, couldn't it?
I think it absolutely could be any of those. So probably not going to give us too much to go on. Shall we have another clue? Okay, so set and monitored by professional bodies such as the ones that we've just talked about, the GMC, the NMC and the HCPC. Anybody want to have a guess now which of the lineup is being described? So Faz is going for code of practice. So we've had an early guess there. Okay, that's totally could be right. Charlotte's going for B as well, code of practice, and Phoebe's saying national occupational standards. Okay, shall we have another clue? Let's see.
Go for it.
A code of conduct is usually part of it. Okay, so within this thing, a code of conduct is usually within it. Okay, so we've got a few more. Zainab and Melvin are now saying, well, we think it's code of practice. Shall we have a look at our last clue then? Guides and guidelines and standards that regulate and improve the quality of care. Does anybody want to join in? Yeah, Sephira's also saying B. Phoebe's saying B. I think there we have quite a good consensus there, Liz, on B. Is it the code of practice? Yes, yep. Absolutely. So very important that you know what a code of practice does. And yes, it applies to all those employers and workers. Professional bodies set them and they monitor them to make sure they're working. Code of conduct, so how people should behave in the setting, is normally within that code of practice. And it really helps regulate the quality of care so people know what they should be doing. So yes,
Fabulous.
code of practice.
Before we move on, Lynn, I wonder if anyone at home would like to tell us what A means, duty of candour.
Yes.
Anyone want to have a go at giving us a
good idea.
definition? Just type it in the chat for us. Just give you a moment. Doesn't have to be too detailed, just some key things that you know about duty of candour.
Yeah, you might have learnt about it when you're sort of understanding the role of professionals.
Okay, Phoebe is straight in and saying being honest with patients. Yep, absolutely. Well done, Phoebe.
Yeah, absolutely. Well done. Really good.
Okay, word smash. So, before we carry on, Phoebe just said, so if something goes wrong with treatment, you should tell patients. Yep, absolutely, 100%. Okay, so word smash, you need to look at the clues on your screen and smash them together to make a new key term. So we've got a picture of something on the left-hand side, and then the text says the way a person behaves, especially in a particular place or situation. So what is the picture? What is the text saying? And what would happen if you smashed those together?
Have we got any early guesses? Once you think you get these, you're on a roll, aren't you?
Mm-hmm.
So we might have alluded to this when we've been talking so far as well. So it's all within this idea.
Oh, well done, Fida. Yeah.
Great in there. Well done, Fida. Yeah, code of conduct. Yeah, you've got the code on the left and conduct is what's being described on the right. Excellent. Sophia got it as well. Well done.
Oh, and Melvin. Brilliant work, guys.
And Melvin. Well done, guys.
Okay, the next one. So we've got a picture of something, and then the text says a person responsible for controlling or administering an organisation or group of staff. Smash those together, and what do we get?
I think this is an easy one, but you don't always see it, do you?
Mm-hmm.
Yeah, Charlotte straight in.
Well done,
line
Charlotte.
manager. Yeah,
Zainab
absolutely.
just come through as well now.
Well done, line
and
manager.
Melvin and Phoebe. Brilliant.
Very important in monitoring what professionals are doing in settings. Okay, line managers are sort of the first port of call that often people will go to if something's not going right or they need support.
Oh, this is one of my favourite ones. So there is a picture and then a statement to expel air through pursed lips. What is this key word? And for an extra bonus round of applause, what does it mean?
Yeah, I think we need
brilliant, Amelia. Well done. Yeah, everyone's saying whistleblowing, whistleblower. Okay, what does it mean, guys?
Yeah, what does it mean to do whistleblowing? Or when might you do it? Yeah, either of those. Tell us what you think.
Everyone's getting this one right. Okay, Fida says if you see anything wrong, you must report. Phoebe says complaining to external companies. Yep, great. Amelia, reporting a staff member due to lack or poor quality of care. Melvin says to raise concerns to help keep safety of a service user. Brilliant. Really good.
Yeah. I think you can mash all those answers together and you sort of get almost the perfect answer, don't you?
Yep.
So, yeah, higher authority. Yeah, whistleblowing to higher authority or external organisations. CQC would be a good one.
Yeah,
in that respect.
Especially I think if you've already tried to raise your concerns through normal channels at work and nothing's happening, you're not being taken seriously, which is what Zainab's just said there. You can whistleblow, so you can take it further, you can escalate it. Fabulous.
Great.
Okay, Lynn, do you want to do this one?
Oh, yeah, I like these ones. So we're going to shake some such as seasoning to the end of this statement, okay? So I'm going to read the statement and then I want you to say such as. So service user feedback can be obtained in many ways, such as, and I want you to tell me how. So how can service user feedback be obtained in many ways, such as, and I want you to finish the sentence. So any ideas? What have you learned about service user feedback that could help you answer this question?
Oh, they're all going to come flying through in a second, Lynn. I can see them.
Okay, that's fine. I mean,
Brace
everyone's
yourself.
been really active this evening. I'm really impressed. Okay, some really nice answers. So Phoebe starts us off by talking about family and friends test.
Yep, family and friends
Yeah.
feedback. Yep, family and
Yeah,
friends
so
test.
asking them, so kind of getting them to fill out a survey. Suggestion box, Charlotte's come. So quite often you get that, don't you, for people asking for feedback. Questionnaires, surveys, which could be to family and friends, absolutely. Having conversation. So you might
Yep,
arrange a
nice.
meeting, or you might get some information more informally and then ask for more of a formal meeting to record that feedback. Yeah, absolutely. Should we see what we've got,
Yep.
Liz? We've got some such as, so we shake our salt and pepper on here and we get suggestion box, absolutely, as Charlotte said, or service user committee. Quite a lot of organisation have service user committees where they can regularly consult them on particular things and ask for feedback. So that's actually quite a good thing to write if you're talking about service user feedback, in addition to many of the things that you've said.
Yep,
So yeah, having
definitely.
a committee made up of service users.
Yeah, the friends and family feedback test is actually quite interesting. It was when it was first conceived, we used to have postcards in the NHS, and it used to say you'd hand it out to everyone in theory that you saw in your work or you cared for or treated, and it said, would you recommend this service to your friends and family? And you could say yes or no. It's evolved a bit since then. You now generally get a text message. So if you attend A&E or your GP surgery, you should every time get a text message that asks you for your feedback on your experience. Okay, let's move on. Okay, so a bubble quiz. I'm sure all of you have done bubble quiz with us before. The number of answers that are correct can range from none of them to all four of them or any combination in between. So let's go for our first question. So number one, which of these organisations regulate health and social care settings? Okay, so settings, what you also might know as services or organisations. Is it A, the HCPC, which is Health and Care Professions Council, B, the Care Quality Commission, which you might know as the CQC, C, Ofsted, or D, Nursing and Midwifery Council, NMC. So A, B, C, or D, which ones are correct? Okay, so we've got a variety of answers.
We've got lots of answers, a variety.
Okay, so I'm just scrolling through. Well done to Paige and Charlotte and Zainab for getting it right.
Yay!
So the only two of those that regulate health and social care settings or services or organisations are the CQC and Ofsted. The other two regulate the professionals that work in those settings. Okay, this is a really common mistake on Unit 2 on the Unit 2 paper. So make sure you're really clear in your mind who regulates services or settings and who regulates professionals, because they are different people. For some kind of extra bonus applause and kudos, can anyone tell me a service that the CQC might regulate and one that Ofsted might regulate, because they do different things? If anyone knows that, just wait for you to type.
And that's quite an important distinction, actually, Liz, isn't it? Depending on what the case study is, it will depend on which organisation is the regulator.
Okay, so Zainab has said CQC care home. Charlotte said CQC hospital. Zainab said Ofsted for a high school. Ofsted schools. Yep. Do we know any other services that Ofsted inspects and regulates?
Yeah, because mainstream schools aren't really health and social care settings, are they? So we want those health and social care settings. And that you can get a little bit confused on that, I think.
Absolutely, yeah. Zainab saying nurseries, colleges, yep. Youth care homes, well done, Phoebe, yep. So Ofsted also regulate and inspect any social care setting which is looking after children and young people, especially if they receive any personal care in that setting. So children's home, foster care, adoption services, things like that, which are social care services aimed at children. Okay, so CQC, think of your hospitals, your GP surgeries, your dentists, your residential care homes and nursing homes for adults. And then Ofsted is any social care settings for children. So your foster care, adoption agencies and services, and children's residential care. Okay. Right, let's move on. Number 2, which of these are ways that nurses are accountable to their professional body, the NMC? Is it A, they must have correct qualifications, skills and training? B, they must follow the NMC Code of Conduct? C, they must carry out revalidation every 3 years? Or D, they must be certified as of good character and have good health? So which are the correct answers? A, B, C or D, or a combination? Okay, give you time to think.
So Zainab's saying definitely B, and Faz is saying A and B.
Yeah.
Okay. Any Amelia's going A, B, C.
Okay.
Okay.
You can see Charlotte and Phoebe are saying all.
Yeah. So very much a strong, preference for A and B.
Okay.
But we can see if Charlotte and Phoebe are correct. Nardos is saying all.
Hey Nardos, welcome to tonight.
Yay!
Yeah. So it is in fact all.
Yeah. And these are really, all of these are really important things. And actually, when you're talking about how they're accountable, these are the types of examples that you could be giving in your answer. So you're having the correct qualifications, skills and training, following code of conduct, carrying out that revalidation and being certified as good character. They're all things that you could talk about as examples. So make sure you kind of know what being accountable means in that context. It's really useful, particularly when you talk about nurses or midwives.
Yep. So we're going to look at C in a bit more detail next. I just wanted to say about be certified as of good character and have good health. When you qualify as a nurse or a midwife, the lead midwife for education at your university has to sign a declaration to say that you are of good character and you're of good health. And then once you have qualified, that declaration forms part of your revalidation, and you can actually state that yourself. So you can make that declaration yourself, and you can also get your colleagues to do that as well. So let's look at question 3. So which of these are required for a nurse to revalidate? Is it A, professional indemnity arrangement? I'll just explain what that means. That is a type of insurance that gives you protection when practicing your job. So obviously nurses and midwives, they care for people that are sick, and sometimes bad outcomes happen. So professional indemnity is like an insurance that protects you so that if someone makes a claim, the insurance policy pays out. You must have, should you have 450 practice hours, which is B. C says 5 pieces of practice feedback, so feedback on how well you work. And D, 35 hours of CPD. So which ones do you think are required as part of revalidation? A, B, C or D, or a combination?
So we've got Faz who said B. Phoebe's saying all. She's going straight in saying you need all of these. Amelia's A, B, D, and Yan Yan is A, B, and C. So quite a few people feeling like it's a lot of these things.
Let's
Shall
have
we
a look
see
then.
how many there are? Absolutely, all of them. Really important. And again, lots of examples there that you can be talking about when you're talking about revalidation, what it means. You need to try and explain key terms. So a way of explaining revalidation is giving these examples.
Yeah.
So really good.
Just a further note on a professional indemnity arrangement. If you work for the NHS covers you, gives you that insurance as part of your employment. If you were to work as a private midwife, for example, you might have to purchase a professional indemnity insurance yourself. Or if you worked for a private maternity hospital, then that would be part of your benefits as an employee. Okay. Yeah. Let's have a look at the next one then. So which of these are promoted by regulation? A, continuous improvement. B, public safety. C, quality of care. D, rights of service users. So what do you think? A, B, C or D, or a combination? Let's wait for your answers to come through.
Yeah.
This is
kind regulation, of like, really important.
Why do we have it? Yeah.
Yeah, it's like, why do we have it? What's the purpose of it? Phoebe's in there again. Either her button's stuck on all, or she's feeling really confident that it is all of them. Zainab as well, and Charlotte's all, and Faz is a BCD. Should we have a little look?
Yeah.
You're correct again,
absolutely.
Phoebe. Well done, Amelia. Excellent. It's all of those things. Yeah, the regulation is super important so that organisations are continuously improving. Everybody's safe. There's good quality of care, and there's the service users' rights are upheld. Okay, they're getting that correct care that they should be getting.
Amazing.
Well done.
Okay, I'm going to hand over to you for this one, Lynn. So we're going to do amend the gap on improving a service after inspection.
Yeah, so you've just had the CQC just come round. So I'm going to read this out, and then I want you to tell me what the blanks might be. Okay, so following an inspection report, health and social care services can improve their services in a number of ways. First, they should develop and follow a clear something plan that addresses the areas for improvement identified in the inspection report. So what do you think that first blank is there? They should develop and follow a clear something plan that addresses the areas for improvement identified in the inspection report. Have a little tap in the chat. Tell us what you think that is.
Okay, we've got Amelia saying care, but with a question mark. And then Sephora, Charlotte, Phoebe all saying action.
Yeah, absolutely. So you should follow a clear action plan. I think we can reveal that one, can we? Yes. Clear action plan, because you've been told, where the areas of improvement are. So then you need to develop a plan that says, this is how we're going to address them. Okay. And then they should monitor and review their progress against that action plan regularly. They could improve training for staff and update their something and procedures. What do you think that might be? So you've just had your inspection report back. You're going to do some training, and you might do this other thing as well.
Yeah, Amelia's saying policies, Charlotte, policies.
Yeah, brilliant. Those words come together quite often, don't they?
Policy,
and procedures. Yeah, your policy is your overall telling you what you need to be doing, and then the procedures are the steps of how you're going to carry out the things that your policy is saying. So they may increase the monitoring and something of their staff. So what do you think they might do there? They may increase the monitoring and something of their staff. So off the back of an inspection report, what might that one be?
Okay, Amelia's saying observation.
I think
Sephora,
that sounds sensible.
Observation. Chazaswag, observation, yeah.
Brilliant. So they may increase monitoring and observation of their staff and improve procedures for performance management of staff, e.g. setting objectives, regular something, and appraisals. So what might that one be? Regular something with their staff. Let's see what you think. Who's going to be first? Yeah, Sephora is straight in. Regular meetings. Yeah, brilliant. So you're going to have more monitoring and observation of your staff to improve procedures for performance management as well. Set your staff more objectives. Regularly meet with your staff to check that everything's okay, and deliver appraisals. Okay, that's where you appraise their performance. You look at what they're doing well and what their areas of improvement might be, and what areas of support they need, their CPD needs, those kind of things. So an appraisal is really important. And they can also regularly obtain and review service user something to ensure they are delivering high quality care. I think you can all get that last one.
Yep. Phoebe says feedback.
Yeah, brilliant.
Zainab, feedback. Yeah, well done, everyone.
Yeah, well done. So that's a really good example of how to talk about what you should do following an inspection report, what a service can do. Some nice examples there of, actions that an organisation can take, quite specific examples there. So use that as a good example to help you practice.
Remember, guys, you can watch this video back on replay, and also you can download the PowerPoint from the Tutor2You website. So if you want to have a look at this again in detail or use it in your revision, download it from the website. Okay, so big reveal is next. We're going to give you 5 clues, and I want you to try and guess what is hidden behind the question mark. So clue 1, All health and social care services must be registered with us.
Okay. So it
Would
seems like a
anyone
thing
like to guess?
that you need to register with us. Okay.
Shall I
feel
go
like
for
that
the
could
next
be a
clue?
number of different
Yeah.
things, potentially.
Okay, when carrying out their actions, they meet with staff and service users for their feedback.
Okay. It's quite a theme tonight, isn't there, about feedback, how important it is to get service user feedback.
Would anyone like to guess at this point? Okay, let's go for the next one then.
Okay.
We observe the care that is being provided.
Okay. So we've got some registering, feedback, observation.
Okay, Charlotte says CQC, question mark. And Sephora says CQC.
Okay.
I think they're on the right lines. I think
Definitely.
we want something specific maybe that an organisation might do. So an organisation like the CQC. So we review documents and policies.
Yeah.
And then the final one, we write and publish reports with a rating of the service for the public to see. So I think Charlotte and Sephora, you were correct with CQC, but what is the activity that we are describing here that the CQC does?
Yeah. What do? They are carrying out something. On the top of your side, yeah, CQC, but what do they carry out? That word.
I think they know, but we've just confused them.
Yeah.
Okay, I will reveal, guys.
Let's have a look.
So
Inspection.
Yes, and Faz just wrote it as well. Oh, everyone's saying, yeah, regulation inspection. Yeah, brilliant. Well done, guys.
Yeah, really important.
Okay, so that is the end of tonight's revision live stream. You are all fabulous. Carry on with your revision this week and do join us again on Sunday at 5 p.m. Your exam is on Monday, so we thought it'd be useful to do one on Sunday night. We are going to look at anti-discriminatory practice, empowerment, rights and choices. So Lynn and I will see you on Sunday at 5 p.m. Thank you so much, everyone. Take care and good night.
Well done. Bye. Thanks, everyone.